the contents of the presentation and where we start from, and it is from that first meeting, but we start 30 years ago, probably, at least, yes, 30 years ago, because it was the first report from Lighton in Europe, the report on wildlife disease surveillance in Europe, and later what we do and the first result and the future. When we start 6 years ago, the tender is collecting and sharing data on wildlife population transmitting animal disease agents. So many of us are in, because we are we are interested in pathogen in disease, but we don't work on pathogen and on disease for the first year. The first time we discuss about pathogen is in 2021 at the second ENETWILD general meeting, just with this presentation on that point. So it seems that the first 4 years, we don't work on pathogens. Things changed really quickly because just 1 year later, we organized a workshop on harmonized and integrated wildlife disease surveillance across Europe. So it is really 1 year later, and we publish. There are a lot of colleagues, a lot of friends are in, and we do a report. And the report is based on what we want to do, which are the main of we want to achieve with that report. So describe what we have at the time in Europe, but also explore how we can evolve and adapt to detect new pathogens. Everyone is waiting for diseases, even if we don't know the name of disease X. And moreover, our aim at that time was to draw a proposal and to try in some way to implement the actual system. And we have a lot of colleagues that participate from many countries, from academia, from public administration, and we produce a report. And the result of the report is that wildlife disease surveillance is not a program, but a system. We have to think at a system. We have to think that we have to make One Health really one, not just people that have several trials that are parallel amongst them. We have to mix each other to share data. We need supranational organization. We have an organization at vertical level, but also at the horizontal level. For example, in the same country, in the same region, agriculture, wildlife, and human health doesn't speak each other. So now we are speaking about sharing data among countries, but many times in the same country, it is not possible to do this. And moreover, we have to empower and potentiate the system, and everyone have to play his own role. The academia role is not to do the usual job. We are not done by routine. We are to think, to draft something, and to let to people from the administration to do their job. And really, we have said a lot of things. We have suggested best practice, and it seems to work because 1 year later, because the meeting was in March 2022, 1 year later, we start with EFSA with subcontract 10, the one that Dolores said. And it is really a lot of work in really a short time. But we really do a wonderful things because EFSA required us to revise literature, but moreover, to support EFSA in an exercise of prioritization disease all across Europe. It was the first time in Europe they do this, and they do at the continental scale. And it doesn't work. We have worked a lot. We have produced the report. You can read the report. It is important. we start to think about integrated One Health monitoring, not only on wildlife disease, on wild population health or ecosystem or human health. We try for the first time to merge all together. We try to discuss what we have to do to reach our goals, and we produce some good cards. We select pathogens. We produce cards for pathogens. We produce cards for several host species, carnivores, ungulates, lagomorphs, rodents, and so on. We try to evaluate how could be important and relevant to monitor one species and one pathogen, or which species for those pathogens. And the result was really good, because at the end there is this paper, but moreover there is a project where the vast majority of members of European member states participate and have money for starting a new project on wildlife surveillance. So I believe this is really 30 years of work. It takes a lot of time because we start from all the literature. It means thousands and thousands of papers we have to read. We have to select 15 pathogens, delete 5, and out of 45, we have 2 workshops with all colleagues from all the administration of all the member states. We've discussed with them, and this was good because they start to feel it is something they are really in, not just something that someone asked them to do, but it's something they participate. At the start, there is not a good agreement with them, but at the end of the second workshop, they really start to behave like colleagues, like mates, and we send questionnaire to every member state, to every agency within the member state. So this is the result. Every member state have maybe different view of which is the most important pathogen, or which is the most important host to monitor. But at the end, we was able to select 10 of them. And it is really good because we can start for this. Alessandro say we have 2 problems. One is African swine fever, but it is not a zoonosis. But the other is avian flu. But avian flu is one of the pathogens that now member states try to monitor in wildlife, and we can use those data also for future works. So what about the future? We have done a lot of job. 45 report is correct the number, Joaquin? You can't remember? No. Okay, so probably are 46. Okay, so a lot of work, really, but now we are bricks. Now we have started to do this, but we have to improve now, and we have to put bricks together. And this means to continue to collect data on animal population, pathogen distribution, but moreover, as you discuss now, and as the integration of data from population, so it means ecological data from wild and domestic animals, with data on vectors, on pathogen, and from different database. And for example, Alessandro before introduced the Sigma, that is the EFSA project, that could be really a good point where we let data from domestic, wild animal, and pathogen merge together. And we have also to increase, if you want to speak in really with a One Health perspective, links with human medicine, and really integrate animals' ecological and epidemiological data with human health data. And also we have to develop new tools for example, for the detection of pathogen from the environment. Joaquin discussed about the use of environmental DNA, for example. But moreover, we have to share our knowledge. And before doing this, we are to sharpen the chain, we are to sharpen the axe. Otherwise, we will work with the lumberjack paradox. You use the double of the time for cutting the trees because you have no time to sharpen your axe. And we have to reverse a bit, maybe in the contract, thinking in advance what to do, we being well prepared and not working every time in a hurry, even if every one of us is here because we was able to survive in our field. We work with nature, but we learn from nature. And it is clear, it is not the strongest that survive, nor the most, and we are not the strongest, not the most intelligent. No, we are not the most intelligent, but surely the most responsive to change. And we have shown to be able to be responsive to change. Because really, more or less to say, only, yes, something more because he's Italian, something less because he's German, but more or less we are together. So in Switzerland they are better because they have both the part. Okay, but really, I believe our strongest point is we are able to change. We are able to understand things and to change quick to what happens in the world. And it is really the right time. As Alessandro said before, 10 years ago, nobody will know. Yeah, more or less, remember a fair with many of you, with Christian. It was very difficult, but it was 10 years ago. And they listened to us, but just listen, doing other things, just sometimes listen what we are doing. But in the previous 20 years, nobody listened of us. It is completely different now. They ask to us. It is not they only listen from us. They are asking to us. So really, this is the good time for me to do what we are working for years, what we are prepared for. Oh, sure. Yeah, I believe the bone is too big. At least to coordinate all of you is a bone too big for me. And what I fear most is this bureaucracy. You know, I have forgotten to put a picture of my desk, but I have won the most important prize in the world, the most messiest desktop from the EWDA young guys. But I believe we are the right guys. If not us, I don't know who other can do. If not now, I can imagine when we can do. So thank you very much.